More than 750,000 people worldwide are diagnosed with cancer every year, but the outcomes are better than ever. In fact, in the last 40 years, survival rates have doubled due to better prevention, detection, and treatment. Among those areas of improvement, surgery to remove cancers. Joining us is Dr. Jennifer Tseng, Chief of Surgical Oncology at Beth Israel Deaconess Medical Center. So good to have you with us.
It's a pleasure.
Clearly, you are saving a lot more lives of cancer patients thanks to surgery. Talk about some of the latest breakthroughs in surgical technologies.
It's very exciting times for surgery, especially for cancer. One of the ways we've really been able to make a difference is we're better able to determine who will benefit from surgery. For instance, we can determine who doesn't even have cancer yet, but is at high risk for getting cancer, so we can truly prevent cancer, cure it in its entirety. Another way is that we've also developed minimally invasive techniques that potentially can perform the same operations with equal or superior oncologic or cancer outcomes. It's just a tremendous time to be in the cancer field and also in surgery.
And you told me that cancer patients are very well educated these days, sometimes thanks in part to the internet.
Right.
And they may come to you wanting surgery and advocating for themselves for certain types. Talk about robotic surgery versus sort of the old-fashioned way, and who is the best candidate?
Well, minimally invasive surgery is very exciting, as I alluded to. The most important thing that I tell people is first you need to decide whether or not, and be informed as to whether or not surgery is an option and the best option. Once you get there, then you can decide, and your doctors should be able to guide you as to which approach is better, such as a minimally invasive laparoscopic or robotically assisted approach. You want to make sure that you're not just looking for a technique, but that you're actually looking for something that's going to prolong or, perfect your survival.
Just because it sounds exciting
That's
and
right.
like the
That's right.
hot new thing
That's
doesn't
right.
mean it's best
Right.
for you.
That's right. You want to be guarded and optimistic in that approach, because if something has been done extremely well, you don't want to be experimented on until you know that your chance of making a great recovery and also having a good cancer outcome is the same or better with the traditional technique.
A lot of cancer centers use the words multidisciplinary. What does that mean, and why is it important?
The way I think of it is, in the old days, surgery and cancer treatment in general were very doctor-centric. You as the patient went and you had an appointment and you saw a doctor, and then if that doctor said you need to see another doctor, then you'd have to figure everything out and go see the other doctor, and the patient had to move from place to place, and sometimes the physicians wouldn't necessarily even communicate. So you as the patient are left basically as the quarterback of your own health care. What multidisciplinary care truly is, and what we do, is that it's patient-centric. So there's a whole team of experts that is assembled around you or your loved one and are all there on the same page communicating with each other, so the patient just needs to focus on their recovery.
Diagnosis of cancer comes overwhelming, devastating, yet you have to pick yourself up off the ground and find the right treatment team, the right place to get your care. How do you advise people to even begin?
Well, I tell people to first take a deep breath, right? Cancer is a terrifying time. It's when things fall away, and the things that are most important are in your mind, your life, your legacy, your family, all those things. But cancer is not usually a let's do something in the next 5 seconds. Let's find the quickest way. The multidisciplinary team you alluded to is important. Patients do need to do some research if they can. The internet is a scary place, but there are some good resources. For instance, the American Cancer Society has great resources, certain other educational resources that are available. But then after that, seeking out a team that is multidisciplinary, where you're not looking for the latest and greatest one thing, but a true multidisciplinary team where, for instance, surgery, medical oncology, radiation oncology, pathology, in my case, gastroenterology, are all on the same page, focused on the same patient, and then they can offer a whole spectrum of care, no matter what the diagnosis is.
Well, it's certainly good to know that your team is there if we should ever need them. Thank you so much, Dr. Jennifer Tseng. Good to have you with us.
Thank you. It's been great.